Hey GW, have you been staying home during the COVID-19 outbreak, or did you still party it up on spring break? Are you practicing safety measures to protect yourself and your loved ones? Will you be part of the movement to stop the spread? As a member of the GW community of nearly 30,000 students, faculty, and staff, your actions make an impact in the heart of Washington, D.C. and around the world. We are in challenging times. Fear and uncertainty are surrounding us and getting worse every day. The number of cases and deaths aren't stopping, and it is scary. You may be asking yourself, why is COVID-19 a big deal? This is not the common cold or influenza. It is significantly more contagious because it spreads like wildfire among pre-symptomatic and asymptomatic carriers.
From the beginning, it was a little bit too optimistic to believe that something that spreads so easily would be containable in a way. It was very different than SARS and MERS-CoV.
COVID-19 does not discriminate. It is not limited to race, age, sex, or ethnicity. Each of us is vulnerable in the eyes of this virus, some more than others. So how did we get here? Many rumors, conspiracy theories, and misinformation have emerged over the last few months.
A lot of people will have this, and it's very mild.
Children are not really affected.
They'll get better very rapidly. They don't even see a doctor. They don't even call it.
Conspiracies are easy to believe, but we're facing a real-life challenge across the globe, and we must come together to save as many people as possible. You alone can impact the world by staying home. You can save hundreds of lives by not being the one asymptomatic person going out and unknowingly infecting dozens of individuals. We know staying home is not fun. You're young and healthy, and it's a buzzkill. But this goes beyond you. It's about your grandmother and grandfather, your friends and family who are vulnerable, the healthcare workers, nurses, and doctors on the front lines trying to keep us well and help those who are sick. You need to stay home for them. You can be part of the social distancing movement. You have the power to flatten the curve, and your choice to stay home can help contain the spread.
We can reduce the spread of COVID-19 by taking simple steps, physical distancing, social distancing, and staying at home as much as we can. Taking care of ourselves, taking care of our loved ones is also our best defense to protect the community as well.
Our nurses and doctors need you. The power lies in your hands. What you do from this day forward will directly impact the course of this virus across the United States. So do it for the families around the world who can't say goodbye to their loved ones as they die alone in a hospital bed. A vaccine will be the panacea and save us in the future.
So we're developing a vaccine for COVID-19. It is based on several of our previous projects where we were investigating vaccines for MERS and SARS coronaviruses, which are very closely related to the virus that causes COVID-19.
But we can do our part by social distancing until that time comes. We must come together and do what is in our power to flatten the curve. The choices we make will impact the trajectory of our entire society, and experts have offered several recommendations on what we can do.
I feel we should be implementing this social distancing or physical separation, which in many respects means staying at home to the extent possible. And I do think we should do it broadly throughout the country, because although there are hot spots that we see that are very obvious, there is the threat of outbreak virtually everywhere and anywhere within our country. What people don't fully appreciate is that putting a mask on yourself is more to prevent you from infecting someone else. And if everybody does that, we're each protecting each other.
The closure of stores, restaurants, and entertainment not only impacts us socially, but has hurt our economy significantly. And it is difficult to see a recovery anytime soon. Millions are out of work in the name of social distancing.
The last paycheck was this past Friday, and they took away our stipend. So it was already it's a stipend. They took it away.
You're paying a lot of money to learn in a classroom and be on an urban campus in the heart of DC. Leaving mid-semester is the worst that could happen, especially if you're a senior. Some of you can't leave if your home country is on lockdown or if you fear US borders will not reopen before the fall. Some don't have the ability to do online classes because of financial and internet availability either. There are significant mental health concerns that arise from isolation, especially at a time where you rely on social interactions. You also have the challenge of adapting to technological issues and professors who are inexperienced in online teaching, making it difficult to be motivated.
Being in an in-person class is what I prefer, so I was just also kind of bummed. Tough to stay engaged when we're doing the same design but in a different format.
I think online class will be fine, but the internet problem is always exist. So I think it will influence like kind of group assignment or.
But think of all the positives that come with staying home. Look at the environmental impact. Less pollution and CO2 emissions across the globe. During a crisis like COVID-19, we see the best come out in each other. There is a resilience and a strength that shines, and we have an empathy and concern for our fellow man that is undeniable. Social isolation is hard, but this crisis brings out the good in society. You are learning to connect and adapt in ways like never before.
And we've done video calls, and like Fridays and Saturday nights we'll do this app called Hangouts with friends and play games, and
Also using a lot of FaceTime and Zoom to actually connect with family and friends and do like virtual game nights, virtual movies.
Connect with friends, like a lot of video calls, game nights.
Social distancing slows the spread and gives healthcare workers time to prepare for patients and get adequate resources to care for those in need.
If we don't do the social distancing, what happens is we don't flatten the curve. So that means we have like a steeper increase in cases and therefore deaths, which can also overwhelm the healthcare system. And once the healthcare system is overwhelmed, then kind of all bets are off. Then we may have, more cases and more deaths that could have been totally preventable.
This term, we are cautiously optimistic that we are slowing the infection rate. That's what the numbers say. That's what the data suggests.
Staying home may disrupt our lives, but it saves lives. Without a vaccine, this is the best way we can protect the greatest number of people. Less people will die because you choose to celebrate birthdays virtually, start Netflix movie parties, and download online games to play with friends. Life will go back to normal, but not if you don't take the first step. Social distancing saves lives. So stay home, because they can't.
Stay at home.
Stay home. Stay home.
Stay at home.
Stay at home, guys.
Stay at home.
Stay at home, please.
Please stay at home.